Today we're going to show you an oral mechanism exam. The oral mechanism exam looks at the structures of the face and the mouth needed for speech. The parameters for the exam are structural integrity, structural size, symmetry, strength, tone, range of movement, speed of movement, steadiness, accuracy, and you look at the structures at rest, during sustained postures, during movement, during non-speech tasks, and during speech tasks. The oral mech exam looks at 4 different cranial nerves. Cranial nerve 7 for the face and lips, cranial nerve 12 for the tongue, cranial nerve 5 for the jaw, and cranial nerve 10 for the soft palate and velum. Today we're going to do an oral mech exam on Ashley. First, we're going to look at her structure at rest to see if there's any asymmetry. And so her corners of her lips are symmetrical, as are her eyes. Now I'm going to ask her to wrinkle her forehead. Good. The wrinkling of the forehead shows if there's symmetry in the forehead. Next, I'm going to look at the structures of the mouth, of the lips. So I'm going to ask Ashley to pucker. Good. And now retract. Big smile. And now go back and forth like this. And that looks at the range of motion of her lips. I'm going to look at Ashley's labial seal. So I'm going to ask her to puff her cheeks. And I'm going to push. And that assesses the strength of her labial seal. During an oral mech exam, we look at the sensory of the face. So I will ask Ashley to close her eyes. And I'll ask her if she can feel my touch. Usually use a cotton ball or a Q-tip. So she felt all those, so her sensory is fine in her face. Next, I'm going to look at the structures of her tongue, or the hypoglossal nerve. And so first I'm going to just look at the tongue. So I ask her to open her mouth. Tongue looks normal at rest. Now I'm going to ask her to protrude. Good. And retract. So, yep. Good. And then I'm going to ask her to lateralize her tongue, so go back and forth as quickly as she can to look at the range of movement and accuracy. And now to put your tongue tip up. Good, and tongue tip down. And then go back and forth as quickly as you can. Now look around your lips like this. Good. Now stick your tongue in your cheek. This assesses strength. Good. Other cheek. Good. The next task is a speech task to assess the tongue's range of motion and accuracy. So I would time Ashley for 20 seconds and I'd tell her to say pa 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 as fast as you can. Pa 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 pa. Good. And now do ta 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 ta. Good. And now ka 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 ka. Ka 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 ka. And the last one is padaka 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 padaka. And again, I'll do that for 20 seconds for each one and record how many times she could say the sounds in padaka. The next thing we're going to look at is the velum, or cranial nerve 10, the vagus nerve. And so first I'm going to look at it at rest. I'm going to ask Ashley to open her mouth. And I'm going to look at the structure and see that it looks normal. And make sure she doesn't have a cleft palate. And so now I'm going to ask Ashley to say a sustained ah, ah. Good, and now go ah, 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 ah. And that way I can see the movement of the velum. Now I'm going to look to see if Ashley has any nasal emission during speech and for sounds that aren't nasals. So I'm going to hold a mirror underneath her nose and ask her to count from 80 to 89.
Well, 81, 82, 83, 84, 85, 86, 87, 88, 89.
Good. And so I look to see if the glass fogged up when she was saying non-nasal sounds. The last structure I'm going to look at is the mandible, or cranial nerve, the trigeminal cranial nerve. And so first I'm going to ask Ashley to open her mouth, and I'm going to feel her TMJ as she opens and closes. And so I look for the range of motion in her jaw and to feel her TMJ. And so next I'm going to look again in her mouth to make sure that she has all of her teeth and that that is a normal occlusion. And so next I'm going to test strength. So I'm going to ask her to open her mouth against my hand. And then next I'm going to try to open her mouth, and she's going to try to keep it closed. Good.
My name is Ashley, and now I'm going to do an oral mechanism exam on Alana. First, what I'm going to check is her facial nerve 7, and I'm going to look at her face and her lips. So right now I'm looking at her face and her structure at rest, and everything is symmetrical. Her eyes are symmetrical. Alana, can you smile for me, please? Good, and we have symmetrical retraction of the lips. And Alana, can you wrinkle your forehead for me? Good, and we have symmetrical wrinkling of the forehead, which indicates no motor neuron pathologies. Alana, can you pucker your lips for me, please? And can you smile? Now pucker and smile really fast for me together. Good, and there was symmetry in the range of motion. Alana, can you puff out your cheeks for me? Good, and that shows strength of the facial nerve. I'm now going to test the sensation of Alana's facial nerve. Alana, can you close your eyes, please? And when I touch your face, I want you to tell me if you can feel that I'm touching you.
Mm-hmm. Yep. 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 Yep.
Good. Okay, and Alana's facial nerve is functioning for her sensation. I'm now going to test Alana's tongue, which is cranial nerve 12, the hypoglossal nerve. Alana, can you stick your tongue out for me? And open your mouth really wide. Good. And her structure at rest looks functional. Can you protrude it out all the way for me? And retract all the way back in. Good job. As she was retracting, I checked her frenulum, and it looked adequate. Lana, I'm going to check the range of motion of your tongue. Can you move it from side to side? Good, and do it as fast as you can. Good. Now, can you move it up and down? Good. And can you lick your lips all the way around? Good job. And all of these functions tested her range of motion of her tongue. Now I'm going to put my finger or my hand on your cheek, and I want you to push your tongue against my hand as hard as you can. Good. Good. And that was assessing the strength of her tongue. We're now going to do the Diadoco kinetic testing. I would be measuring this for 20 seconds, and I would be notating how many times she said the phoneme. Alana, can you tell me pa 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 pa?
Pa 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 pa.
Good. And ta 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 ta.
Ta 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 ta.
And ka 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 ka.
Ka 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 ka.
And finally, can you tell me padaka padaka padaka?
Padaka 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 padaka.
Good. And that assessed the accuracy and range of motion of her tongue in the speech task. I'm now going to test Alana's velum, which is cranial nerve 10. Alana, can you open your mouth really wide for me? Good. And I'm looking at the structure at rest, and it looks functional. I was also checking for cleft palate. Alana, can you sustain the sound ah for me with your mouth wide open?
Ah.
Good. And I was looking for velum movement. Alana, can you also tell me ah, ah, ah?
Ah, ah, ah.
Good. And I was looking for velum movement and range of motion again. Next, I'm going to check for Alana's nasal air emissions. I want to check that if there is air coming out of her nasal cavity on nasal sounds, and to make sure that there's no air coming out of her nasal cavity for non-nasal sounds. Alana, can you count from 70 to 80 for me?
70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80.
Okay, and good. So there was air coming out of her nasal cavity during the nasal sounds and no air for the non-nasal sounds. Okay, and the final structure I'm going to assess is Alana's mandible, which is cranial nerve 5, the trigeminal nerve. I'm checking her structure at rest, and it looks functional. Alana, can you open your mouth for me one more time? And close your mouth with your teeth out. Good. Now it's checking her teeth and the condition of her oral cavity and for any occlusions, and everything looks normal. Alana, I'm going to test the strength of your jaw. Can you open your jaw while I'm trying to close it? Good. Okay. Now I want you to keep your jaw closed while I try to open it. Good. And I'm now going to feel the range of motion of your jaw by palpitating your TMJ. Can you close your mouth, please, several times? Good. And everything feels within normal limits. And that's it.
Thank you.